Thank you very much, Elvis. Ever wondered who made these bracelets and what purpose they serve other than funky beaded jewelry? It's estimated every day at least 600 children worldwide are newly infected with HIV, with most of them living in sub-Saharan Africa. Most of these children acquire HIV from their mothers during pregnancy, but a non-profit organization called Mothers to Mothers, together with Relate Bracelets, is making a difference. 1 in 4 HIV-positive women who delivered their babies in countries supported by M2M received education and support in the last year. Joining us now from our studio in Cape Town is Mothers to Mothers representative David Torres and then the CEO of Relate Bracelets, Neil Robinson. Very good morning to you, gentlemen. Thanks for joining us.
Morning.
Good morning. Thank you, Evan.
Let's start with you, David. Mothers to Mothers enrolled nearly 490,000 women in the program in 6 countries in sub-Saharan Africa in the last year, including more than 100,000 HIV-positive women. Tell us about what the centre and program, what it does for these women.
Sure. Thank you, Evan, and thank you for inviting me to come on the show with Relate. Mothers to Mothers employs HIV-positive mothers as peer educators. And we deploy these mentor mothers, as we call them, to work in clinics and in the community to help newly diagnosed pregnant women and new mothers diagnosed with HIV navigate the healthcare system, get on treatment, and ensure that they take care of themselves so they can stay alive and raise their children, and take medication to prevent transmission to their children. Mothers to Mothers was founded 15 years ago here in Cape Town. We're a South African organization working across 7 countries. And as you said, we have scaled, we're a social enterprise, and we're helping a huge number of women across 7 countries in sub-Saharan Africa.
If I can go across and talk about, Neil, talk about your role in the whole process. Just give us your overview of the last year.
Thanks, Eben. So we spoke a couple of months ago, I know, and since we last spoke, we've really dialed up the needle. We've probably done about 8.5 million rand this year to different causes around South Africa and the world. So we're sitting on about 33 million now, money raised to date in just 5.5 years. We're actually selling our 2 millionth bracelet this month. And, you know, Mothers to Mothers is a great partner of ours. We got together a couple of years ago, and, you know, we've always looked for, you know, both local initiatives as well as global ones affecting, you know, the continent as well as the planet, not only South Africa. And I think David and his team has been wonderful in respect of how we leverage the AIDS issue, as we call it. And I think it's a very positive, proactive and quite humbling program that they run. And we partner with programs like that. The guys have got big ambitions, big goals, as we are. So it's a great privilege to work with them.
We've just had World AIDS Day. If I can go over to David, tell us your experience here in sub-Saharan Africa. Do you think that we are getting to a tipping point where we're turning the tide?
Yes, actually, that's a very good point. I do believe we are. South Africa is a perfect example. In the last 5 years, South Africa has made huge progress in reducing the number of children who are born with HIV. We feel that we've been part of that. And we, in addition to partnerships like the partnership we have with Relate, we work very, very closely with the Department of Health. So Mothers to Mothers over the past 3 years has been working with the Department of Health across a number of provinces to take our model and integrate it into the healthcare system delivered by the government as well. So in addition to the mentor mothers that Mothers to Mothers employs and the women that we're seeing in the programs that we run, we've now set up hundreds of sites in Limpopo and Gauteng that are run by the Department of Health with our help, who are taking our model and running with it. So we look at the sustainability in our model as partnership with the Department of Health. We feel as an organization that we're combating the severe shortage of healthcare workers in sub-Saharan Africa. There aren't enough doctors, there aren't enough nurses. But if you can imagine you're a young woman coming to a clinic you think you're pregnant, you've booked an antenatal appointment, and you're very excited, you're a bit terrified, and when you see a nurse, she tells you that not only are you pregnant, but you're also HIV positive. You lose the will to live in an environment where stigma is still as terrifying and as terrible as it is in South Africa, and where there isn't enough time, given the shortage of doctors and nurses, to really spend time with clients to explain that HIV is not the end of life. It's not a death sentence. It doesn't mean that your child will be infected. A mentor mother being there with that nurse, who the nurse can refer the client to, can spend the time with that young woman to explain to her that by getting on treatment, she can live and she can make sure that her baby is born free of HIV.
That's brilliant. Now Neil, tell us, talk to us about the support that you're getting from South Africans for the product, the bracelets, and are South Africans aware enough of what needs to happen, and are we willing to chip in?
I think even if South Africans know where the money's going to, I think they're very eager and willing to chip in. I think the bracelet is a very simple mechanism. Of course, it has to have an R on it to distinguish between other bracelets. If South Africans are given the choice, they want to do something good. Give them easy options. You know, if you make it available at great retail outlets, it costs 39 Rand, most of them. It's not a lot of money for a tax-paying South African to get involved in. You know, my ambition at Relate is to get every tax-paying South African to buy one bracelet a year, one R bracelet a year. And in doing that, we can raise R250 million for good causes, Mothers to Mothers being one of them. You know, we're supporting 82 causes around the world now, most being in South Africa. South Africans will do good if they know that it's a reputable organisation where the funds are going to where they should be going, and make it easy. I think that is the bottom line. Make it easy for people. There's so many issues in South Africa. Cut through the clutter and make it a simple, easily accessible thing to get involved in.
David, finally, you've got 30 seconds to tell us what is next. What do you see in the next 12 months, 36 months for Mothers to Mothers?
Thank you, Evan. What we would like to see is a mentor mother working in every health facility in the country, and mentor mothers working in community healthcare settings, so that every woman who comes to the facility, whether she's HIV positive or HIV negative, has someone there to help her navigate the healthcare system. And by doing so, we believe that we'll overcome the shortage of doctors and nurses in South Africa and other countries in sub-Saharan Africa. That's our vision. Thank you.
Fantastic vision. Thank you for the Herculean task that you guys are doing. That is the CEO of Relate Bracelets, Neil Robinson. That's the man on your left on the screen. And, of course, today he was with David Torres of Mothers to Mothers, who represents Mothers to Mothers, not just in South Africa, but the entire sub-Saharan part of Africa.